In this video, we are going to review the basic process of how to get up and down the steps after you return home from surgery. Before you leave the hospital, you need to make sure that you review with your physical therapist your specific situation. So let's get started. So this is how to use the walker when you're going up the steps. Doesn't matter if these steps are inside your house or outside your house when you're coming home. This is going to be demonstrated with a rail. If you have steps to manage that are multiple steps that don't have a rail, please have somebody with you on the opposite side of the walker to give you further support. So as you notice, the other thing I want to point out is depending on the depth of your step, sometimes when you turn the walker sideways, it doesn't fully fit on there as you're going up. I've actually put the wheels on the inside of this walker to reduce the width a little bit to give me a more firm support as I'm going up the steps. So when I approach the steps here, we're going to say my surgical leg is the right side. We're going to lead up with the good leg first. We're going to, in this circumstance, we're going to take the walker and we're going to turn it like this. We're going to place it right here on the step. Okay, so before you step up the step, you're going to give this a push to make sure that it's secure, and we're going to lead up with our good foot first. So we're going to push on the walker, grab the rail, push up, and bring our surgical leg up. Then we're going to take this walker, we're going to move it up the next step here. Again, we're going to test it to make sure it's okay. Then we're going to step up with our good leg first, and then our surgical leg. So this is demonstrating going down the steps with a rail and a walker. So again, my surgical leg is the right side. You're going to go down with the bad foot first. When you're doing this, you're going to again check this walker, make sure it's stable on the step before you put pressure on it. You put pressure on the rail and the walker. You're leading down with the surgical leg and then your good leg. Then you're going to advance the walker down. Going to check it for security again. Down with the surgical leg and then the good leg. So now I'm going to demonstrate how to use a cane going up the stairs. Now, after surgery, if your weight bearing is tolerated, if you're concerned about using the walker, you don't have enough space, there's a possibility of using a cane if you have a rail for the other side. You need to consult with your physical therapist on this though and make sure of your weight bearing status. So when you're going up the steps, we're going to say my surgical leg again is the right side. You notice you're always going to put the cane in the opposite hand of the rail so that you have support on both sides. If my leg in this instance the surgical side happened to be the left side, it's still okay. We want the cane on the opposite side of the rail, no matter what the circumstance is with the surgical leg. So here's how you do this in this instance. Your cane is always going to follow your surgical leg. You're going to step up with your good leg first. So the cane and the surgical leg are going to stay down for a minute as you step up with your left leg. So you're stepping up with your good leg. You're pushing off the cane and bringing up your surgical leg. Again, you're pushing off the cane, bringing up the good leg, and then bringing up the surgical leg. So this is going down the stairs with a cane and a rail. Again, a reminder, my surgical leg is my right side. We're going to lead down with the bad leg first, okay? So as we come down the steps, I'm going to place my cane so that it can give me some support as I'm lowering myself. I'm going to bring my surgical leg down and then my good leg. I'm going to place my cane, I'm going to bring my surgical leg, and then my good leg. So when returning home with your loved one after a hospital stay or a skilled nursing facility stay, you need to assess how you're going to get them in the house. So this is often an option if you have a platform step that can fully hold the walker. This might be your first option. So in this case, again, you need to look at how high is the step and how strong is the individual coming up to the step. So in this case, I would bring the walker up to the step. We're going to say that my weak leg or surgical leg is my right side. So we're going to come up to the step. We're going to put the walker up. We are always going to lead up with our strong leg first and then come up with our weaker surgical leg. So now let's take a look at a second option. So a second option in coming up onto a platform step, and it seems to be what is being taught coming out of the hospitals more frequently, is to back up to the step with the walker. So you're going to get fairly close to it before you start backing up. You're going to turn this walker around, back right up to the step, And then again, you're going to lead up with your strong leg. So my surgical leg is my right side. So what I'm going to do is step up with my left leg, push myself up with my arms, and bring my right leg up, and then the walker comes up onto the platform. So that's a second option on coming up to a step like this. Now let's take a look at coming down the step. So when you're coming off of a step like this, it is a platform step, you're going to go forward off of this step. So you're coming fairly close to the edge here. You're going to put the walker down. You're going to lead down with your bad foot first. So this is my surgical side. You're going to put that leg down first. Use your arms to lower yourself, and then bring your good leg down the step.